Hello, welcome to Dr. Philip University. We have engaging and interesting video lectures on all medical, paramedical and dental subjects. Sign up now to watch our online courses from anywhere.
Yes, my specialist. So see, for the treatment of cancer, we used to give radiation, and that is called as radiation therapy. In radiation therapy, when constant radiation therapy is just given, that affects the oral mucous membrane and that causes severe inflammation of the oral mucous membrane. That inflammation of the oral mucous membrane caused by constant radiation therapy is called as radiation mucositis. Radiation mucositis. Now we are just going to see about radiation mucositis. So inflammation of the oral mucous membrane following radiotherapy. That is the meaning. Inflammation of the oral mucous membrane following any radiotherapy. Now the first point to be just noted is the basal layer. Always in the epithelium there are many layers of cells. Among them the base, the foundational basal layer contains differentiating intermitotic cells. Please understand. See, this is the epithelium and layers by cell. The basal layer is here. This basal layer only from here, this basal layer, these basal layer contains differentiating intermitotic cells because they only divide into two and they go up and follow and they form the whole epithelium. So differentiating intermitotic cells make the basal layer. Those intermitotic cells of the basal layer are very sensitive to radiation therapy. That is the first point to be noted. And this problem starts in the second week of radiation. Slowly the symptoms will be seen in the second week of radiation therapy. What are the symptoms you just see? Areas of inflammation and redness. You understand? Areas of inflammation fully you can see areas of if you happen to give radiation here inside fully in the very mucosal regions, areas of redness and inflammation will be seen. And later on, when more and more radiotherapy is just given, what happens is the oral mucous membrane breaks off. Please understand, when first of all area of redness and inflammation will be seen. After that the oral mucous membrane breaks off, and in different areas it will break off. And what happens is when there is a break, and after that a small membrane will be formed. Break, and after that a membrane will be formed. The membrane formed after breakage is called as false membrane or pseudo membrane. So the important point to be noted is later on, after inflammation and redness, after that breakage of the epithelium happens and pseudo membrane is formed. That is the point. The mucous membrane breaks and pseudo membrane forms. So that is a real thing which really happens. And after the pseudomembrane formation, what happens is the oral mucous membrane becomes small. See, it will be microscopic structure will be so big. The epithelium, the outer covering of the oral mucous membrane is so thick, but it becomes small. Becoming small, the oral mucous membrane becoming small and thick. As it becomes small, it becomes thick. So becoming small and thick is called as atrophy of oral mucous membrane. Right? The oral mucous membrane becomes atrophied and thick. That is the point.
Hope you enjoyed watching. Gain full access to our video lectures by signing up on our website. Visit drphilipuniversity.com for more details.